Hi guys, this is Coach Green Jean,
And I'm Dr. Doula.
and we are so excited for thanking you. We're thanking you guys for joining us for another online live discussion, paper versus paper. And we're looking to very much slow walk this particular online discussion because we have very, very special guests in the green room
Oh my
waiting
goodness.
to begin to have a very pertinent and important conversation. But before we start, we do want to make sure, right, that we draw your attention to the purpose of this particular discussion. And so you guys know that Andrea and I, we have developed a 3H pre-apprenticeship workshop. And with that particular workshop, uh, we work with young people between the ages of 12 and 17 as it relates to skill sets and embracing and allowing them to embrace their crafted talents through working with their head, their heart, and their hands. And so while we're continuing to go forward, we're not able to have the workshops, but we are continuing to have our guest professionals begin or continue to speak to our parents and our young people as it relates to navigating their career path and building sustainable pathways for future generations. So don't forget, at any time during this particular online discussion, please go to YouTube and subscribe to our YouTube channel, Coach Green Jean. And on that
All
particular
right
channel,
now.
I see you, bro. I see you. You better be
you
clicking and such.
you
I
will
felt that
be
in my
able to
stomach.
take advantage and watch a lot of the archived information that we have where other guest professionals, we have architects, general contractors, electricians, homeschoolers, everyone speaking not only on their profession, but they're also speaking from a place on navigating this global pandemic and how they are posturing and positioning themselves as it relates to quarantine. This is a very daunting time, but at the same time, is a very important time. And so we're hosting individuals to come and share with us professionals that we feel that can actually speak comfort, speak healing, and also provide strategies and insights to assisting you to be where you need to be, you and your family, as it relates to coming out of this particular situation and being where you need to be so that you're passing down these amazing skills to your children, the next generation. So, without further ado, I would like to introduce to some and present to others our very, very, very special guest hosts, Miss Christy and
Mrs.
Jamil Willis.
Hey,
Hello.
everybody. Thanks for having me, family.
Oh,
Hey, this is well, she used to be doula mom when wait, before. I'll let her tell you what she calls herself now, but this is my friend. This is my friend.
Friend to
And
the end.
yes, honey. And let me tell you, so this is Doula Mula. I'm so excited. I'm gonna let her introduce herself because she does so many awesome things. And then anything she leaves out, I'm just gonna say, "Girl, you didn't say this," and "Girl, you didn't say that." But we have we have connected in so many different ways,
Yes,
um, and even as far as partnering in doula work together, which I
yes,
absolutely just love.
sure.
She has such a wonderful spirit. And I've had the opportunity to serve as a postpartum doula for her as well, and
Yes.
just in other things. I'm just so excited to talk with her today. Our families have so much in common. But I'm going to
Mhm.
start by allowing Mrs. Christy Willis to introduce herself. Please tell us about yourself.
Well, I am Christy. You could just refer to me as Christy. Yes, I used to be doula mom. That was in my early days, and I barely knew what I was doing. And I thought that I needed to be called something else than my name so that people would know that I'm a doula, you know. But anyway, yes, I am Christy Willis, and I am a birth postpartum doula. I'm a breastfeeding mentor. I am a general mentor. I am a virtual doula coach, and a doula business coach as well. And I'm an author of the Doula Business Journal. I am a mom of 5. And there we are.
There they
It's
are.
one in the oven on that picture, if you can see.
Yes, honey.
The older ones are a little bit bigger now. And I'm a homeschooling mom. I enjoy cooking, baking, crafting, singing, loving on Jesus, and all things birthy and doing it myself.
I love it. What does that mean, doing it yourself?
Um, I like to do things myself. I like to figure out how to do things myself instead of always calling for help. If I can figure out how to do it, I will. I got that kind of from my father. He was in the constructions or housing maintenance type of field, and he was also a military man. But anytime you found him doing something, he was building. He was doing something with his hands. He was fixing. I have pictures of him underneath my sink, and my kid, one of my children are right next to him, and they have a tool in their hand, you know. And so he really taught me, like, this is how you do this, and if you want it done right, try to do it yourself first. You know, if you can't, then you can bring in a professional, but most things you can do yourself. So I've taken that on. You know, I taught myself. My mom taught me how to sew by my hands, and I never knew how to run a sewing machine. Someone gave a sewing machine to me, and I was like, I need to go take a class at Joann's or something. But then I was like, no, I need to learn this myself. And I figured it out myself. So, yeah, that's just me. I like to do
Now,
it
I'm
myself.
going to have to jump in, Dr. Doula, because Christy talked about her dad and him being a contractor, and Christy
Yes.
knows all of our hearts, which
Yeah.
is to express that importance of the head, the use of the head knowledge, the use of
Hmm.
the hand knowledge, and the use of the heart knowledge. And I didn't know. And
Yeah.
so that is a wonderful part about why we're having you here, and that's to speak on self-sufficiency.
Yeah.
And so,
I was gonna say that too, and I was gonna also just add a word before you continue. Is I see it as self-sufficiency, self-reliance, but the word that I really love the most, that I think serves us, is the ability to be resourceful
Yes.
yes,
within ourselves.
Yes. Absolutely. And if
yeah.
I ever
So,
feel like that I can't do something, I can learn. I can call my sister, or you know, by birth or by whatever. Hey girl, I know you know how to do this. How do you plant this? You know, how do you do this? You know, and resourcefulness is very helpful, and it brings longevity.
It really does. I'm sorry, babe. You
Mhm.
were saying something,
no, I was
and I
just saying,
did.
Christy and Dr. Doula, I'm going to make sure I don't mess her name up, but Deja Daniels, she's
Deja
online and she
Daniel.
said, oh, hey, family. So she's here just
Deja is
saying,
my
hey.
first niece.
You know Deja. That's
Wow,
Don
You
and
know Deja.
that's
That's
my
Dee Dee.
Deja. Hey,
Yes, that's your
Deja.
Deja.
he's
That's
not
Dee
married.
Dee.
He's not used to the married name.
The Daniels. Yeah, she's married
Okay,
now.
She's
congratulations.
Yes.
So yeah, Christy, come on, sis. Let's begin to slow walk this situation as it
Okay.
relates to you and your amazing husband. You know,
Mhm.
we're in these particular times right now as we're all, as family people and professionals, navigating the quarantine. And we just like to hear
Absolutely.
from you personally, because there's a lot of things we want to make sure that we speak on, uh, you you and Dr. Doula, as far as it work pertains to the doula work and postpartum. But I also like to hear professionally and as a family how you guys are navigating this time with the homeschooling and your own work.
Yeah.
Talk to us a little bit about that.
Well, I like to say that I navigate this whole thing just like I navigate maternal mortality rates in Black African American women. Um, It's not that we're dying, we're living too. So with COVID, it's the same aspect. What are you going to do to protect yourself? Are you going to be educated? Are you going to wash your hands? Are you going to wear the mask? Are you going to take that childbirth education class? Are you going to get some evidence-based facts and be strong enough to present them to your provider so
That's
that
right,
you can
sis.
make the right decisions for yourself and your baby? I take the same approach with COVID. Get educated about it. Protect yourself and your family and follow the steps so that way you will not become or have a less chance of becoming that number.
Mm, so
And you,
nice.
I'm sorry, love. Go ahead.
No, go ahead, doctor.
No, I was gonna say, I was saying earlier, and I love. Um, I was mentioning before that there's so many similarities that our families share, and oh, what you got out there, girl?
That was a
One of
B. I'm good.
you just so
Sorry.
sweet. You so sweet.
That's what it
Um,
is.
but one of the things is that, and I try to be gentle because everything nowadays is about, are you shaming someone? And this is not a shaming kind of thing, but
Yes.
I often tell people, homeschooling all of a sudden, and someone distinguish between schooling at home and homeschooling, but
Right.
homeschooling and being at home with your children during this time or whatever time, while they're learning,
Yeah.
has when I was doing it for 13 years, it was not respected at all. You know,
Right.
and you mentioned when we were chatting before the broadcast, people talk about, oh, they're going to be so socially what's the word? What's
Unsocialized.
unsocialized? Oh, they're raising those unsocialized children, and we hear all these
Mhm.
comments about what this is and what that is. How many years have you been homeschooling now?
I think it's over 17 now. I
Go
stopped
through,
Mm,
come
counting. I
through,
just, yeah, I just,
teach your
my kids are
kids.
growing and I don't even count
Exactly.
anymore. I just figure out the oldest one and then minus 2 years. And then, yeah, that's how I do it.
See, and so for you, because there are some, with everything that's going on, there are some individuals who are becoming more mindful of the fact that, you know what, wow, I don't know if I want, necessarily right now to send my kids back to school, or I
Yeah.
wonder what this whole homeschooling thing is about. And we'll
Yeah.
talk about that as it relates to birth in a little bit. But
Yeah.
as far as homeschooling, I don't know if you remember how it started for you. I know for me, it started
Yeah.
with my youngest ones, and so I grew into it.
I
But what words
definitely.
or statements would you make to people, or what would you say to people like that are just thinking, like, I don't know, do I, homeschooling? Is that something that I really can do? What would you say to them?
I would say that you can do it. I mean,
mm.
just like I would say to anybody, you can birth your baby no matter how it comes out by cesarean or vaginally. You can birth your baby. The baby is made to exit, okay? The baby's
Talk,
going to come
girl.
out and you can do it. So if you're having that inkling, if you feel that inkling of maybe I should, that's your instinct kicking in. Just like, oh man, should I take baby to the hospital or, something's just not right. It's not sitting right with
Exactly.
me. That's your instincts kicking in. And it's nothing wrong with giving it a try. This is a perfect time to give it a try. There are many families out there who've always wondered and not
Yes,
had the chance because they have to go to work, but now some families cannot go to work, and then they have
exactly.
maybe one parent that is essential, but the other parent has to stay behind, and they don't have a choice but to be patient. Sometimes they don't have a choice but to say, okay, we're not doing school today because I can't not do it, and that's
Exactly.
okay. You're learning how to homeschool the best way
Yes,
that your family is made to do, the best way for your family. And that's a lot of things that people miss out on when they consider homeschooling. They think of the normal homeschool setting, and it's totally opposite from what, okay, y'all, we got to get up at 6:30 because if y'all don't eat by 7, then y'all going to be late to class. It's like, no, first of all, they need a well rested sleep. Okay, they
yes,
need to be
exactly.
well rested. They need not to have cereal just thrown down their throats for breakfast. They need a well balanced meal. Let them help in the kitchen. There, you're covering one
Exactly.
subject already. You know,
Exactly.
let's read together in the morning. Let's have Bible study together in the morning. It doesn't have to be every morning. Okay, let's go take a walk in the morning. It's so many things that you can do outside of the standard that will offer your children more learning opportunities than they would in a normal classroom setting.
You know, Christy, let me say this, Dr. Doula, before we go on, that's why the Little Mason household is growing from level to level, just because of what you just spoke on. That woman over there, that woman over there, Dr.
Over there,
Doula,
over there.
you know, me, I'm a sergeant at arms. I have to have it a certain way and have to have it at a certain level. And sometimes we deal with fear. We deal with the curse of comparison, trying to keep up. But the way you subscribe, what you just talked about, talking to the families, talking to the parents, is specific of saying, you know what? It's okay by allowing these situations, these new ideas, these new thought processes to come to us and not allow the pressure to just, of comparing ourselves with the family next door. And I love my wife for that, and the way she does it, of course. Go over there and sit down somewhere.
Hey,
but when you're confident in yourself and you've been living this thing for a while, and you realize that as couples, as business partners, you have the best interests of each other in mind. You don't take offense. And it's going to be all right, because you know what? Maybe I need to take a seat right now and just allow my kids to go out and cut the grass with just supervision. Allow them. She says, okay, you Coach Green Jean, why are you trying to do everything yourself? They're 17, 15, 18, let them, so I just really appreciate what you had to say as it related to, allowing this thing to come, to you. I'm sorry, Dr. Doula.
No, I was just going to say, I love the whole concept. I'm not going to say I'll just say sometimes, people feel that when it comes to the freedom I have to do things the way I want to, you said this is a great time. What is it that, and I'm going to get to birth because it's so hard to not talk about birth with you.
It's hard.
Right, but I'm going to finish at least get through my
slow walk it.
homeschool
Go ahead and
comment.
slow walk it. That's what I'm talking about.
There's so many things that people have said, I want to do, I want to explore, I want to this, that, or the other. And when it comes to things like homeschooling, what does that day look like? It could look different. If you've been in Chicago and it's been snowing 2 weeks ago, you might not be outside just yet. Maybe you will be. Maybe it wasn't enough snow for snowballs, but or snowmen necessarily.
Snow angels.
maybe you're somewhere else where it's just rather warm and you could get out there and you are planting seeds or doing something. This is not a one size fits all. And the mistake that we make, and I've always said this, is that when our kids are with us, yes, it's good to have. I understand for those that their children are accustomed to a schedule and a precise schedule. I understand the temptation to duplicate that.
Yes.
But I always remind people, being one who's worked in the public school system, in the public and private, online and the whole nine. Man, I got bars. That was bars. That was
bars.
Thank you. It's important to know and to be able to shift, to say, okay, the things that are done in the school system are done this way because they're not teaching my 2, 3, 4, 5 kids. They're teaching 120, 150 children. They have to make this, institutionalize it. They have to make this. So when I go in and I say, did you give my child the same opportunity you gave this other? I have to be able to show that. I have to be able to prove that. So I don't want us to lose focus of the opportunity that this is. There are people that have wanted to do stuff for so long. And in different places, like my nephew here, he's finished all the work that was required. My sons, and my sons are still completing things. They'll be finished in a few weeks. This is the time for you to say, okay, what is it that thing I've been complaining about the school system's not doing all this time? Maybe you can't necessarily go to the museum right now or this right now. But what are the other things that you said that if you got a chance, you would do it. And I just love that you pointed that out. And
Yeah.
I'm going to shift now right over and let it segue
Hey,
into.
that's a good way. I'm gonna let you segue, but I want to talk to the people and say, make sure these women are saying good things. So push the like emoji, the laugh emoji, the heart emoji. Make sure you subscribe to Coach Green Jean and give
And
us your
share.
questions. Give us your questions. Give us your questions because we're
Yes.
taking the questions. I want to make sure that we use Christy and Jamil Willis all the way up and get everything that
Use us
they
up.
have for us on this broadcast. All right, Dr. Doula.
Exactly. And it's my friend.
Oh,
Do
that's
you see
so
that baby?
sweet.
And she's wearing her bound by birth wristlet.
Yeah. Why you
That
gotta? Let me get it together. Cause
listen,
look, Coach
stop.
Green. Come on now.
Stop.
Okay.
Okay. You see me, right? That's what I was telling. Look at I was telling him, I said, don't tell her I got these pictures.
That's
Don't
so
tell her I got these
sweet.
pictures. This is my
That is
friend.
so
And she's
sweet.
wearing the wristlet that I made for the South African
Yeah.
midwives when I went last year, had an opportunity to visit.
Oh,
And just that I do as far as being daughters of the African diaspora. And that has to
phenomenal.
do um,
Hmm.
in that realm. I'm always talking about birth. And that is not taboo.
Yeah.
Sankofa is not taboo to go back and fetch what we
No,
forgot. This
that's
woman,
right.
now, first of all, you need to, if you want to see the interview I did with her over a year ago, when she was talking about her virtual
Over a
work,
year ago.
the virtual
Yeah.
class she teaches for doulas,
Hmm.
the all the other stuff, and she talked about her home births, unassisted
Yeah.
as well. Stop playing with me. When he
Yeah.
said write your questions, this is the one to write it to. Make sure you
Yes.
write it.
I'm
What
here.
question do you have, honey? And it's a blessing for me that I had an opportunity to be able to journey with her in parts of her last two
Yes.
births, and that was a blessing to me. And we also were able
Last
to
three.
partner together. I knew you were gonna tell me it was three, girl. Oh my gosh, you are so right.
Three.
Last three.
We'll share
This
that. We'll share that
we'll
another
share
day.
that
Dr. Doula has to
exactly.
share that another day.
I like right. I have the pictures here, and I will describe what that is. You know, I when it
Woo.
comes to, however, dealing with, I'm going to encourage you to go to YouTube and look at well, you can just go to my website, drdoula.com. And if you
Yeah.
look at the Birth Her Story blog, you will find an interview with this sister right here. I have over 20 interviews with amazing women that deal, some of them specifically with birth as doulas, others telling their birth stories, others as herbalists, all of these women that are doing things that are impacting women, Black women, that are sharing their stories. Christy shared
Yes.
her story about her birth, some just how she progressed
Hmm.
from, and I do say progressed because it took a trusting of herself in some ways.
Absolutely.
She started,
Yes.
with birth in the hospital and how she progressed through some things. I'm not going to ask us to
Hmm.
recant all of that because we took our time with that girl, and we went and I
We
went to
went.
her house. I was like, listen,
Yes, you did.
let's recline on that couch, girl, and tell us this story. But this, but,
Look! Oh my
but
goodness! Look at this picture.
these, let me tell you what you're seeing. No, Christy, tell them
Yes.
what they're seeing. Tell them what they're seeing.
In this picture, you are seeing the one and only Dr. Doula guiding my daughter Angela in binding my body after a miscarriage. So this was postpartum care, and she just took the opportunity. My daughter was there, and she just took the time to teach her different things. And my daughter always has a birth book in her hand, either a birth book or a Bible, and so she was in the space, and so Dr. Doula, being the doctor and the educator that she is, took the time to show her how to bind me back up and how to keep me from being wide open, right? That was her
Ah,
favorite thing
that's
to
how what she
say.
said. Wide open, mama. You help me, so I won't be wide open.
Taught her
I
how
love.
the gentle touch and how to move
Yeah.
edema and what to look for, and yeah, so it was beautiful. It was beautiful.
And
Thank you so much for that. I know I said that a million times before, but thank you so much
girl,
for doing
I
that.
want.
Can I say something real quick?
What?
I,
What do you have to say,
lady,
Coach?
I'm basking in the moment because
Oh,
we're talking about head, heart, hands,
yes,
sisters helping
yes.
sisters,
Mm-hmm.
brothers helping brothers.
He's the
We're
Yes,
best.
talking about getting
absolutely.
back to self-sustainability.
Absolutely.
There's a lot of things that we can be doing by building up our skill sets. Do we know the importance of building up skill sets? That's how we all reach our individual crafted talents. And with that,
Yeah.
we'll be walking in purpose. How much
Mm-hmm.
more our communities will be so sound, so secure, and financially backed, and everything else if we just took the time to support ourselves and took the
Mm-hmm.
responsibility of supporting one another. And I tell
Yes.
you guys, these photos right here
Mm.
are just so they just
That one.
outstanding.
Oh, look at
Tell tell him
Gloria.
about that one. Tell him about that one. Miss Anna Lee was
This
inside.
picture is Annalie. I was very
Very.
pregnant with Annalie. And Andrea and I were serving the beautiful Gloria. And this picture makes me laugh every time because I hate feet. I
Yes.
do not like touching feet. But when it comes to I don't. But when it comes to a pregnant woman or a birthing woman, something just comes over me and all of my attention is drawn to just making sure that they are comfortable, that they
That's
are
right.
relaxed, and that the tension leaves their body by any means necessary. So
And it was a
that's
blessing
nice.
to be able to serve Gloria with you.
It
Christy
really was
has such a
with you
gentle
too.
spirit about herself, and it's very rarely where you can find someone that you feel like you partner with them in a certain way, you
Yeah,
connect with them in a certain way. And Christy, it was just a great balance. It was a wonderful balance.
it
Um,
was.
being able to compliment one another, and so I absolutely love that.
It
And
was
even
beautiful.
regarding working, I'm so glad you
Yeah.
put that back up. Look at that girl. Let me tell you, you know I do you hear me? My
That is
heart
my
just flutters
daughter.
because
That
first
is
of
my
all,
daughter
that is your daughter.
verbally being verbally guided to release, and she's just helping me release, and Dr. Doula is verbally guiding her, and you know how she talks, and
She's
just be
so
gentle and just move your hands like this, and if you feel, ask her if it's okay, and it was so sweet. It was so beautiful.
oh my
I love
goodness.
pictures because it just brings you right back to that moment and that space. So, look at this, my favorite picture. This is my favorite. This is
This-
my
What's happening
favorite
there? What's
picture.
happening there?
Here, she's continuing to do the binding and closing of the bones
yeah,
for me, and she is guiding my daughter once again on what to do. And
Closing the bones?
yes,
yes.
Dr.
Cause
Doula,
when look, cause when you have your babies, you wide open.
wide open.
I just love her little voice when she said it,
That's what
wide
she
open,
said.
wide
Closing the
open.
bones. When you're pregnant, no matter how long you've been pregnant, things
That's
start to
right.
shift. Things starts to soften your bones, actually soften up the ligaments,
And the ligaments, yes.
shift, and so usually what happens is after the birth, everything starts to go back together, but you can feel a little loose. You can feel
Hmm.
unstable. And the closing of the bones kind of helps to, just like a bandage would or a cast, except for it's not left on for weeks, but it kind
Yeah,
of gives them that space. This is where you're supposed to go back to.
exactly.
It's very comforting. It's very physically and mentally rewarding to
I
have
think
And
that.
the beautiful thing I like about this is that you ladies are touching on some amazing and awesome things that have to do with just indigenous practices that our
Thank you.
people from Africa have always
Yeah,
practiced. And we're just being reintroduced to these things. And I'm just so thankful these skills are just being reinitiated
yeah,
in our homes. And what better time through this quarantine to learn these practices?
they truly are indigenous
absolutely.
practices that any culture,
Mhm.
um, any non-Western culture, that they have some type of ritual that is done for a pregnant
Yeah,
woman. Um, it's only
Yes.
with modernization, and I mean modernization in the sense of, 60 or so years ago, um,
Mhm.
it was still, well, I'll say it in the context of segregation when black women, because I'm down here in the South now, so all of my people, I'm the
Mhm.
first generation. Me and my sisters were the first generation on my mother's side to be birthed in a hospital. And Christy shares a little bit. Also, you shared, who was it that you said, well, your family's from Alabama as well.
My family's from Alabama. I remember my mother being born at home. My aunt Pat, and she still lives in Alabama. One time when we were there visiting, she drove me around to the house that was built by, I think it was my grandfather and some other family members. And my mother was born in that house. And I'm like, who was there? Well, the midwife, and then, members from down.
Exactly.
They would come. They all knew their part, and that's just what happened.
And
So
that's why. And wait, I have to stop because I'm coming back to this point. Go back to you see this little striped shirt on these pictures. This
yeah,
little stripe, honey. That's my little Aunt Annalie. That's my birthday buddy.
yes, it
That's my
is.
that's
And
my birthday buddy.
this is the beauty. Yeah, that is your birthday, birdie. But this is the beauty of. I just want to point this out. I just have to interrupt you for this. The beauty
Okay.
of allowing children into birthing spaces, into postpartum spaces, is that they know what is supposed to happen. When Dr. Doula comes to my house now, what happens? She lays out her mat, and little
Good.
3-year-old Annalie lays on it automatically. And
Yes.
what does Dr. Doula do? She takes her little foot
Yes.
and she rubs it down and she says, "Is that okay?" She talks to her just as gentle as she would talk to me. But that is the beauty of it, because one day she's going to grow up and say, "This is what is supposed to be done." And
She it's just really
it's
something.
beautiful.
It's so true. And then when it's her
It's true.
mom's time, we still have to put another something down for her because she's
Hmm.
got to, no, I'm
We
supposed
have
to
to,
be
yep,
here. I'm
she's
supposed
supposed
to
to
be
be
right
there.
here too.
Hmm.
And then so in these pictures, she was up and she was helping. She was like, okay, what do I do now? What do I
Yep.
do now? What do I do now? And little hands just working. And the beauty of that is um, a testament to what you were just talking about, everyone knowing what they were supposed to be doing.
Yes.
Um, it's not
Hmm.
because we instinctively just like, ooh, you
Right.
know, no, it's because generationally these things were passed down. These,
Absolutely.
everyone knows I call myself Dr. Doula, but when I look at what's done, I acknowledge and I know
Hmm.
based on my historical context that wait, this is what was done. This is what my grandmothers, when I asked my great aunts, because
Right.
unfortunately I didn't ask all the questions I could of my grandmothers when they were here. But when
Yeah.
I asked them and I said, wait, well, who helped you with that? And who did that? Because they were not, they were waiting for midwives that were not driving to them.
Right.
These,
Absolutely.
these midwives were not driving to them.
No.
They,
Mm-mm.
you know, they were not, oh, I'll be there in 20 minutes, I'll be there within the hour. No, when
No.
it was time and she started feeling pains and things like that,
Yeah.
who's laboring with you? Who's there? It's your family.
Yep.
It's your family. It's
It's
the
your
women
family.
in your area. It's whoever, auntie, whomever, and cousin, whomever, and the women
Yeah.
around you. And I say, and I say as well, for me, my husband was that, and that's
Yeah.
another thing that Christy and I share. When people say your husband cannot support you, perhaps I would not go as far as to say every husband should do whatever, but
Of
I
course.
can tell you
He
that
able.
he
He's
able.
able.
Come on now, okay. My husband, just like Christy's testimony about
Hmm.
her birth, my husband was my rock. And I always say it this
Yes.
way, he amplified my voice.
Yes.
And that's what we do as birth support people, whether you
Yes.
call yourself a doula, a birth
Or
keeper,
whatever.
however
Hmm.
you phrase that, you know,
Yeah.
you're amplifying and the voice of that mom and helping her get the things that she needs. And so
Absolutely.
I get so excited because Christy and I are going to be doing some things together that we
I
can't
can't
wait to tell
wait.
you about.
Can't tell you about that.
Can't
I
tell you, but
can't wait.
Just stick
but
around and see.
just Just stick around, and it's going to be powerful. And it has to do with that whole generational aspect of things, the
Yes.
passing on. You know,
Hmm.
by the time our young people and our young women have gone and heard all of the messages that have been passed to them through media, through that movie they watched that was so
Right.
funny,
Uh-huh.
that got good laughs, but was implanting in them
Yes.
fear of birth.
Hmm.
By the time they get that message, and now it's like, oh, I'm 25 and I think I want to be a doula, but I think I'm so scared, and I think and where do I start? That's not how we traditionally did.
Nope.
Tell me, if you had to describe the Cliff's Note version of how you got from hospital birth to an unassisted birth with your husband, how would you describe that?
You see, I'm leaning in, Christy. This is
Look,
good information.
I would describe it as one of the most powerful events and situations, and it is still powerful to me. Sometimes when I feel like I can't do, I kind of go back to that and say, well, I can.
come on.
And it happened progressively, like you described. And luckily for me, it doesn't happen like this for every woman, but it happened by accident. I didn't intend to have an unassisted home slash van birth as my first one. I didn't intend for that to happen. I wanted to get to the hospital because that's where I thought I would be safest. That's where I was told that I would be safest. And so I wanted to get there, but I also had that inkling of birthing at home. I wanted to, but I was afraid because I'm like, well, what if this, and what if this goes bad? But although I had those what ifs, I backed those what ifs was up with education, and I started to study.
Come on.
But I still had the fear. That's the only thing. I had the know, I had the education, I had the know-how, but I still had that fear. And I think that because I had the education and I had the know-how, God just allowed me to you know what? Let me show you what you can do. And so not even on the way to the hospital, we tried to get out for the hospital. And
Justin said, I'm coming now.
I'm coming now, and we were in the driveway of our house, of our home, and I'm in the van, and my instincts took over. I said, I'm not sitting in the seat. I'm going to recline it. I'm going to get on all fours because that's what my body kind of forced me to do. My husband turned the car on, turned it off, and next thing you know, he was like, "Help, Lord!" That was his
Hurt
help,
one,
Lord,
hurt
because
two.
baby was already crowning and coming out, and I'm like, "Oh my word, I'm doing this! I cannot believe it." So it gave me the power at that moment to say, not only to say that I can do it, but my husband can do it too. He can support me. He doesn't need to read a book. Instinctively, he's my protector. He loves me. He cares about me. He cares about our baby. And no matter what, he's going to do instinctively what he needs to do. And that's exactly what he did afterwards. He was kind of he went through an anxiety fit and he had a hard time, but in that moment he was everything that he needed to be. So I really don't like to hear people say that husbands cannot do. What we need to stop doing is stop telling them what they can't do. Get them the education in their hands and give them the room for their instincts to take over.
I
You
love
heard it
that.
here first. You heard it here first.
No, she heard
On
it out.
paper versus
She heard it.
paper.
I
Coach
can't deal
Gray
with
and
you.
G.
I can't
Hey,
deal with you.
that's before they start the Dr. Doula mom connection. Hey, so Christy,
Yes.
with that, what are some of the things that a birthing mom, an expected mom, a mom wanting the education with her and her husband, where do they start, especially in the time of being home and secluded? Where do they start, and how do they transform their mindset, their livelihoods around the home to prepare for something like this? What little steps can they take?
I think the first thing and the most important thing is to be educated in childbirth. I think you need to know what happens during the time of pregnancy and what happens during the process of birth, because a lot of times people get scared when a woman starts making noise. It's like, no, Noise is good because we know that she's breathing and she's not holding
Exactly.
her breath. Um, they're not really familiar about how the baby turns or how maybe the baby looks, or may not know how to look for signs of we need to get some extra help because
Hmm.
or to say, you know what, I'm not a candidate for home birth. I probably should, I'm high risk, or, I have gestational diabetes. This is not really a good idea for me. So I really need to stick with a hospital birth. So it's not to say that home birth is for everybody. We have to be
Exactly.
very knowledgeable about that. And that when you're knowledgeable about childbirth and pregnancy and the risk factors and that surround high riskness and home birth in general and birth in general, then you are educated enough to make your own decisions. You can say, hey, okay, we know if this happens or if you're having this issue, things like that. So the best thing that you can do is really get educated. And one of the things you can do, you can get with Dr. Doula. She offers that virtually. You do not have to childbirth education. I mean, Dr. Doula, am I telling the truth? You can get
You
with
are.
her
You
and
are.
she can offer that to you. And we have to support the men in the communities as well, because a lot of times they're standoffish about birth. They're standoffish, especially about home birth. It's like, oh, and they're standoffish about doulas. um, we don't need to invest in her or him because what for, what do we need that for? And they have a right to ask those questions. And
Exactly.
how about, instead of turning your head to that, let's get educated together. Well, this is the information that I found, and let's look over it together. Well, okay, well, if you
Exactly.
feel like I don't need one, how let's learn for you to be my birth partner. It's
Ex-
okay. It doesn't have to be a whole, because you get all up in arms about why you can't get a doula because he don't want you to, and here go your blood pressure going up, and now you having issues. Work together with who you have, because that's what we used to do anyway. And
Come on.
I tell the students in my class all the time, because one question, and this, Dr. Doula, that goes around. I mean, they say that 85% of their paying clients are Caucasian, and they can't get any of their African American or women of color to hire them as their doula, and they really don't know why. And I'm like, baby, because we never had to pay
Girl,
nobody to
tell
help
it.
us.
Would you
It's
would you
not.
tell the people?
We
Talk
we
about
we
it.
had
You
we
heard
had
it
our
here first
sisters,
on
our
Coach
midwives.
Training.
My husband is
Our
crazy.
midwives, our midwives were our doctors. They were our mentors. They were they did everything in the community for us, our neighbors. Everybody had their part, because it's not that they knew, okay, this is what I'm supposed to do. They used what they had.
Head.
If you knew how to sew, then you was gonna sew that baby blanket, okay? If you knew how to cook, you was gonna bring a meal 3 times a week. You know what I'm saying? If you knew how to boil some water and you 12 years old, you was gonna be in
You
that woman's
boil that.
house boiling that water, okay? So that's what it means by knowing your part. It's not that everybody had this specific set of skills. It's that they used what they had, and they knew that they can
Hey.
do. They knew that they can help in this way, and they used that to help. And that's how the village works. And that's how babies were born safely, and mothers were not suffering from postpartum depression.
Listen here. Listen,
It-
listen, listen. La Layla, la Layla. That's
La
oh,
Lela.
I'm learning Zulu right now, girl.
That's
I'm on
beautiful. I just had to
my
say it.
husband.
I didn't know what it meant, but
La
I had to
Layla.
say
It's
it.
listen, girl. La Layla. Yes.
La Lela.
Listen. Let me tell you something. I have one thing to say, and then I'm gonna scream over what you just said because it's the truth. The first thing is when you talk about high risk, I've been in the hearings with the representatives where because of maternal mortality rates among Black women,
Yeah.
there are those that try to present it as being Black, being of African ancestry makes you high risk.
Right.
And as she said, educate yourself. That's not, there is no, okay, look at me. Oh, they're Black. You definitely need to be in the hospital just because you're high risk. That's not it. You really need to
Mhm.
educate yourself and to understand
Absolutely.
the things that would make the hospital setting the safest place for you. But by
Yeah.
virtue of being Black, that ain't it.
Mhm.
Just because you know that doesn't make that the safest place. So I want you to just make sure you're educating yourself,
Yes.
understand what it means to be high risk,
Mhm.
and don't allow that title to be put on you. The
Yes.
other thing is, you know I've watched people that talked about, well, Black women, I often say, why are Black women upset? Because Black women don't, necessarily think that they should, you know, pay for services. First of all, that's a mindset, and it doesn't mean if you have a business, they're gonna be people that think they shouldn't pay for food. But if you have a business where you sell food, then you say, oh, well, to get this food you have to pay. Okay,
Right. Mm-hmm.
that doesn't mean that the only people that know how to food are the people that are caterers or
Right.
restaurant owners. Okay,
Mm-hmm.
there is something to be said about the fact that doula, and even the fact that we servant, female slave in the Greek, whatever,
Right.
that it was something that is less than 30 years old as a profession.
Right. Yes.
Okay, there's something to be said about that, and I really don't think that
Mhm.
Black people should be arguing about, well, how won't they pay? Well, because sister, whomever, sis, because there is a place and there is a point in it where you're looking and you're saying, wait a minute, is that $1,000 that they say that they charging? Is that $500? You mean I'm putting that towards a doula? So what's she gonna do? Hold my hand? What's she
Right.
gonna? There's something that's screaming in us. But this is what I add on to that. If you don't think the fact that you don't think that you should pay for that does not then equate to we got it, we got it. You can't just lean on our ancestors and
Yes.
not equip yourself and not
Yes.
educate yourself.
You have to be educated. Yes.
Okay, you have to equip yourself with skills and understanding of the woman's body. And Christy
Mm-hmm.
mentioned what I do. I've been, I was telling Christy, I said, for those of us who've been doing virtual work, and some people say, can you do virtual work? For those of us who've been doing virtual work, Christy's been doing virtual work, if not 2 years, almost 2 years. She's
Yeah.
been doing and offering that probably longer than that officially.
Mm-hmm.
When she
Right.
decided to call it something, it might be 2 years.
Right.
But but those of us who have been doing those things, we know that these are times to say, look, you need to try and consider what all of your options are.
Yep.
So, like I offered the 10 things that every woman should know about birth,
Yes.
10 things that every helper, whether it's
Yes.
husband, sister, mother, whomever,
Yes.
every helper should know about
Mm-hmm.
postpartum, because that is important. And
It
I
is.
just wanted to really, I love so much your resourcefulness, Christy. I love
Thank
that
you.
energy in your family. I love what you offer to the earth. I really do.
Yes,
Thank you.
yes.
It's the epitome, the beautiful non-judgmental of everything. Just the beauty of it all. I absolutely love it, love it, love it.
Thank you.
If there are people that want to reach out and talk to you and connect with you, because like I said, she's been doing virtual stuff for a while,
Oh
and
wow.
and teaching other people how to do it effectively. How can
Yeah.
they start? I mean, I know you're teaching your classes. Tell us about your classes. Tell us.
Well, the class is a 6 week class. It's not self-paced. I like to say that it's not self-paced because it isn't, and it's every week we meet on Thursday. Um, every week of the 6 week span, we meet on Thursday night at 8 p.m. CST live in the classroom, and we go over our session. And it's really it's a step-by-step foundational work to actually help the doula find her target market, find out who she is as a doula and what she likes to do, and really how to build it as a business instead of just taking phone calls. It's not about taking phone calls. It's actually
Exactly.
about education, and if it's a business, you have to run it as one. Um, it's really about building that up and building up confidence in yourself to offer that service, because a lot of people walk into a birth space for the first time and they're nervous, but then you have people who have been doulas who have been doing that for years, and then they try to serve somebody virtually and they're at a
And
loss.
it's
But they really don't understand how a growing problem right now is doulas are being rejected by their current clients by offering
exactly
virtual services, and they don't understand why. Just like not every person wants you as their doula, not everyone wants virtual doula services.
exactly
There is not everybody for that. There's a certain type of person that wants that, and I teach that in the class also. And I teach social media marketing in the class as well. I teach about how to, um, set up the tax information and all that. It's all business, and I love it. I've gotten nothing but great reviews from the birth workers that come into the course. I've had a midwife. I've had um, uh, birth photographers that are also doulas. I've had lactation consultants. I've had uh, so many different great birth workers from all around take the virtual doula course. So just goes to show that it's not just for doulas, because I like to have everything in the course directed. I always say, no matter what your specialty is in birth work, use this information to support your clients using your virtual services. So it's not always specific for doulas. It's good for anyone in birth work. So,
And I just love that. Let me ask you this real quick. You do both. I mean, you're there. You do virtual and you do in person support.
right.
For a person that would wonder, like, I don't get it. How can you support someone? I don't get it. It doesn't make sense to me that you're saying you can support someone that I know, because I've been in a concert and been called out because somebody was in labor. I said, I'll be right back.
Right.
But what does that look like as far as in just like generalization? Like, what does that look like?
Well, it all starts with building a relationship with the client. First, if you get that client wants that. Okay, so it's not that you're just pulling somebody that wants only in-person services. They want the virtual services because they don't want anyone in their personal birth space, and that's okay. Some people prefer blended services, whereas they want someone at the birth, but they rather have virtual prenatal visits or prenatal education done, which is fine. So how does that look? It looks exactly how they want it to look. I personalize my virtual doula services for every client. We do a needs assessment together, where I'm not just asking them a bunch of questions. I'm actually saying statements that they can, kind of go over with me, so that I'm just not like the doctor. We're chit chatting, we're chatting it
Exactly.
up. I'm finding out what they like. I'm finding out, their husband's birthday. I'm finding out their kids' birthdays and what they do in school. And I'm finding out their favorite color, and how they like to communicate best. Not everybody likes a video chat. Some people prefer to talk on the phone like old school. Some people, and it's really all about building a relationship with that person so that they can be open and honest with you, and so that they can also receive information from you. And so it's a good idea to be as open, as honest as you can as possible, because you don't want to be you don't want to have a wall up. You want to be so transparent that they can reach through you and pour into you, just as you're doing for them. And so it's a lot about that. And in the birth space, sometimes I know a lot of people wonder what that looks like. And what I like to tell my students is, you want to pretend like, first you want to pretend like you are deaf. Okay, and you close your ears. You cannot hear anything, but you can see everything. And sometimes that's what we kind of pretend like in the birth space. We see a lot of things, but as a doula, because of the scope of practice, quote unquote, we can't really say too many things. So we kind of, keep our ears closed, and we look and we pay attention to our client. But in the virtual doula setting, you're using nothing
But
but your ears, because
yes,
and that's the most important thing, because a lot of people say, you ask doulas, what do you use most, in your doula bag? And most people would say their hands during the birth. But I can attest, every time I've been in a birth, I've used my voice a lot more than I use my hands. Do I touch? Yes, but that's only if they want to be touched. Just because they
because
want to
all
be
of them
touched,
don't want to be touched.
they can want to
Come
be
on,
touched throughout their whole pregnancy, but come labor, it's like, if you put one more hand on me,
one more.
like, don't even look me in the eyeball. It depends on that person. So my greatest asset in birth, I always say, is my voice, because I know my client, because we built that relationship. I know what she likes to hear. I know what she doesn't like to hear. I know what I can say to somebody. Oh, let me talk to you for a minute. Maybe can you go get us a bag of chips or something, because they need to step out so this mama can have some calm.
Exactly.
You know, and bring it back. And I can whisper things in that mother's ear, just like I can on the phone. Now, usually what that looks like is dad with a Bluetooth headset and me off in the corner, not even seeing sometimes. But that's okay because it's not my birth. I don't have to
Come
see
on,
everything. Um, and if
sis.
dad needs me, I'm just a earshot away because just like I would be in the birth, sometimes dad just wants full control and that's okay. And guess where I am? Sitting on the side, just a earshot away. So I would just sit there, I would listen. Okay, well, she's not feeling this. And okay, well, I hear she's breathing a little. Tell her to take a deep breath, take a nice cleansing breath with her. You do it too, and so it's not weird. It's not odd. I'm just allowing whoever is in that birth space with her to help their instincts take over. So it's a beautiful thing.
I'm over here busting because when you were talking about like maybe she don't want to be touched, I always tell people, and since he's up here grinning and stuff, I'm like, I would be sitting there, and at a certain point, I said, "Listen, I want you right here." He's maybe touching my leg. My favorite. I love the birthing ball. Some women don't. They don't
Yeah,
respond well to it. But that was my
exactly.
jam. That was my jam, baby.
Yeah,
I opened right up on the birth ball, right? But I
there
would
you
sit
go.
there and I'm like, I want you right here. Which one of my friends is that?
Come on, Anna.
Annalie.
This is Annalie.
Hi!
Come on, come on. You can come
Hey!
on.
That's my
This
birthday
is
buddy.
this is motherhood. This is homeschool. You only
That's
get so
right,
much
love.
time, and then you just bring them out. You just bring them
That's
out.
it. That's
It's
it, love. You
okay.
know
It's
that.
okay.
Hey,
My
Annalie.
my thing is, you want to say hello? Turn around. Say hello. Say hi.
Hey!
Hey, Annalie.
My thing is, a
Oh,
lot of people like to say, "Oh, well, what if my kids show up and all that stuff?" And even in the births, just where there are mothers, there are babies, and so we
Exactly.
need to embrace that and let that be a learning experience for them. And it's okay. It's
Absolutely.
okay.
I know with my husband, when we would be in the birth space and you're talking about catering it to what the woman needs, I wanted
Yeah.
him right there, but I
Mhm.
didn't want to hear him breathe.
See?
And I don't know how he managed it, but he would manage it because his breath sounded really loud to me.
I didn't.
I
I didn't
don't.
even know what
Who
holding
did?
space was back then.
He didn't know what
That was
holding
holding
space was.
space.
He was holding
Look,
space.
I was like,
You
I,
knew. You knew what it was. You knew exactly where it was. You
instinct,
knew what it was.
instinct.
You knew. Mhm.
he
Christy, like you
he
said, instinct.
his
Yep.
goal was to be there. His goal, and you mentioned something about like fathers wanting to have control of a situation,
Yeah.
and his instinct was protecting me. That was his
Yes.
instinct. His
And
instinct was,
that's
how can
good.
I? Here's my wife. She's in this
Yeah.
position, where it's like I see, you're in an environment often in the hospitals, and I tell people all the time, it's the only thing that happens in a hospital where discomfort or pain is normal.
Yes.
And so when we get like, why are they trying to give us medication? Well, because doctors, I mean, as far as I know, I haven't been contradicted yet. There is no mandatory requirement that a doctor see a full physiological birth prior to becoming a doctor. They do not have to
Wow.
see. Think about it. I have a
Mm-mm.
friend right now. Her daughter's in the gynae, whatever. She's in the
Mhm.
that rotation. There's no requirement for her to see a birth with non-medicated, non-whatever, to actually be a part of that. These doctors are working from their expertise, and they're
Yeah.
surgeons.
Yeah.
Okay,
And they're surgeons. Yes.
and they're surgeons. So
You
you
guys about to
experience.
go through. You about to go into a whole nother discussion.
No, I'm just
Hey,
saying.
Baby.
I'm
you
just
know,
saying.
I guess that's why I love this discussion so much because you guys are just saying over and over how important it is to trust ourselves, our instincts,
Yes.
and to give time to ourselves to educate ourselves, do
Yes.
the research necessary so that if we have to be in this situation at the hospital because of certain sensitivities or whatever our choice is, at least we'll go into the situation being educated, understanding what our rights are,
Right.
what we should be receiving, and what we should not be receiving.
Exactly.
Exactly.
And a lot of people, they I know that I'm gonna get in trouble for this, but here we go. A
You knew
lot
you
of
weren't gonna be able to not do it. We tried so
I can't
hard.
I can't do it. A lot of birth workers, well, you have a say so, and you have a say so over certain things, but the hospital also has a policy that you've signed. And I know the policy isn't law, but they're covering their tail. That's what they're
Always.
doing. That's what they're doing, and that's what they're taught to do. And so when you go in there and you fight, and you fight and you fight and you fight against the policy that you agreed to, then that really just puts more stress on you, the
Mhm.
laboring person. And so I like to tell my clients all the time, find out what the policy is. See if you can get a copy of the
Yeah.
policy. And if there's anything that you really don't agree with that, talk to your provider to see if there's any leniency with this. If it's not, then you can make a conscious decision of whether you need to switch hospitals, or whether you need to, or you can stay home. So yeah, it's a lot that goes into that.
It's
And
important.
it's
And people
important to
don't quite
know.
get that though.
No.
I've talked to people where in their minds it's like, well, you know, um, I need my doula to speak up for me. And the first thing that I say is, okay, well, this is what I have to help you understand,
Yeah.
that we are guests in the hospital, and we
Mm,
can be uninvited. And I told a story
mm,
the other day how I went to an appointment with my
Wonderful.
father,
Yeah.
and he just had a stroke 6 months ago, and
Oh,
thank God he's able to move and speak and do on his
yeah.
own, but we are very protective of him. And because of
Absolutely.
that, we're like, we need to go in and hear what y'all saying or whatever. But the security looked at me because of the current circumstances and said, we are not inviting guests in right now. Guests are not allowed in the hospital. But doulas,
Yeah.
any who know what doula work is, understand that you have always been a guest that could
mm,
be uninvited by the hospital. And you
mm,
understand that. You know what I'm saying? You understand
Yeah.
that you're the client. You're the one that's here. You signed the papers. You cannot. But if unless I'm skillful with how I communicate and interact, and
Yes.
in this setting,
Makes
this will make it worse for you.
it
This will make it worse. So it's not about getting there and
will. Yes.
you know,
I mean, we just,
it.
as a black doula, we just can't go in there running our mouths.
You got to. I mean, and I'm not trying to be
Yeah.
funny, but the truth of the matter is, this is not the only space where Black women have to know how to skillfully navigate a situation. We
Come on
come
now.
on now, come.
You heard it here first on Coach Green Jean.
You,
You done say something when he say that.
I'm just, I'm just saying, you don't leave that at the
Wait a minute, I
door.
got to put the
Love
ticker
it.
at the bottom, the subscribe ticker.
We have to know that when we go into these settings,
Yeah.
we have to understand that when we are in
There
these
you go.
settings,
That's how you got to do it.
when we're there, we don't leave our Blackness at the door. We don't leave our identity at the door. And we know that um, when you look at the all of statistically and everything else, that women have a hard time. Black women have a harder time. So, come on now, let's use some wisdom so that we can be a help. And you said some things. Oh my gosh, I'm gonna stop talking in a second. But you mentioned, for example, being that virtual doula. For some of us, and sometimes, and
Who's mom?
sometimes
Yeah.
that small voice, I can be in the room with someone or virtual with someone, and my voice is still small to that husband. Okay, listen, you need to go, and this is what you tell them. Because it's like, okay, she says this. This is how you say it. This is how you do it. This is what you do. Because I'm trying to help him amplify her voice. And sometimes he is the best person to do that. Most times he might be the most effective person to do it. This is about making her birth environment um, as best all that it can be. And if she's
Right.
not there with her partner or whomever that could support her, whoever those people are, helping them be able to support her. That's what becomes
Yeah.
important. So how can people get in touch with you? When is your next class? Because we need you more than now than ever. We know every woman won't want a virtual doula, but like you talked about blended services and allowing women to help. Oh, one more thing I had to say. You mentioned also everybody doesn't want someone in their birthing space. And I remember specifically, that was one of the things that happened with you. You and your husband had become so much of a like Wonder Twin Powers activate kind of thing. You were like, I was like, okay, do you need support doing, the birth or the whatever? When she asked me to be a doula, and she said, no, 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 we got that part. You were like, no, we got that.
I did.
You were like, we got that part. I just want you to come after. And when we talk about empowering women, I need you to think about that you went from like every other woman. I'm gonna birth I'm gonna birth at in the hospital. I'm gonna do whatever to get into the place and say, no, no, no. Me and my husband, we got this. But I would like to have you here. I would like to have you do this there. So it's a beautiful thing to have variety. It's a beautiful thing to have options. Options are life to me. How can they get in touch with you? How can they get in this class? When is your next class? All those things. What, and how?
Well, for the person that is expecting and would like to have their own personalized, customized virtual doula services by yours truly, or by one of my clients that may click, by one of my previous students that actually click with them better. I'm not greedy now. I'm not the doula for everybody. Okay.
Come on now.
So, and I'm okay with that. You can actually email me at doulamom24@gmail.com or contact me through the Doula Formula, facebook.com/Doula Formula on Facebook. And good thing you asked about the class, because just yesterday was the first day to begin registering for the summer session of the virtual doula course. And so from May 1st to May 15th is a registration period. And because of COVID-19, and I understand everybody's pockets may be kind of, I'm offering the early registration free through the entire registration period.
Wow.
And there's also a woman of color discount as well. So if you are a woman of color, you can specify that on registration, and you will get the woman of color discount as well. So there you go. And you also get a free doula business journal with your registration.
Wow.
And it's not a PDF. You actually get a real book delivered to you. So
you don't have one. Do you have one to show them really quick? Do you have one around or no?
Yeah, let me just take a walk. Hold on.
Why don't you just take a stroll? Why don't you take a stroll?
Let me go into one of my offices.
Wait, I want to say this first, babe. I want to say this first. While she's getting her book. I love that you did that for these times that we're in, to help women, help families that will want to be a part of that. And also on drdoula.com, one of the things that I'm doing in that same vein, she's so cute. In the same vein is when you purchase the course, you get access for 2 other people. So that's 3 people that get access to the 10 things every woman should know about birth and every helper should know about postpartum. So go check that out at drdoula.com. Yes. Show us, girl. Show us.
This is the Doula Business Journal.
Open it so they can see you not playing. You got them colors and life going on in that book.
Actually, there are no colors in life in this book, because it's specifically for the birth worker to get creative. So this is your personal journal. It's equipped with calendars. It's equipped with goal setting techniques so that you can set realistic goals and work quarterly through your goals for the year. And so that you can actually realistically reach your goals. And what I like about this, you can start it at any time of the year, and it becomes a piece of history for your business, because each year when you get one of these and you fill it out and you're reaching those goals, and it has space also just for you to journal. And so there's quotes in here, there's affirmations in here, and it's just a wonderful place to record. I love it. And get creative, set your appointments, set your goals, and start reaching them.
I'm gonna have to post your thing again so people can see more about you when you go in depth about your birth stories and talk about them. You
Thank
are such
you.
a gift and such a gem. I appreciate
Thank
you
you.
more than you know.
Oh,
Um,
stop.
seriously, I just love you to bits and pieces. I'm so grateful for any um, part of your journey that I've been able to be on with you is an honor and it's a privilege. Thank you for allowing me to pour into your daughter. I was saying before, I don't think I finished my
Oh,
statement. You know, not having birthed physical daughters myself,
yeah.
when women allow me to teach their daughters, I consider
Yeah.
it to just be one of the highlights of my life.
Yeah.
To be able to pass anything on that they can say, oh no, I saw that when I was younger, or no, someone showed me that.
Yes.
I know that I'm walking in the footsteps of the women who've come before us, and I'm doing my small part to impart into them about how they see birth. So I thank you
I love
for
that.
allowing me to pour anything. Look at my friend, to pour anything in into them and to
Mm-hmm.
support you. It was an honor that you, I'll just say this last thing. When you announced your last pregnancy, you said that, you know, I don't even know if I had known at the time. I think I went on Facebook and you're like, and Auntie Little Mason's gonna be my doula. I was like, yeah, what? Huh? Anytime, because I know how, you know, to me it's an honor because, you know, I know people are like, well, how's she gonna assume? Well, no, see, for me, I just love it because I know how in sync you and your hubby are. I know how connected
Yeah.
you all are. And to even be invited into a space that's so sacred with any woman
Right.
and is one thing, but to be invited into your space and to be entrusted with anything like that is just
Yes.
it's meaningful to me. And
Yeah.
so there are doulas all over Chicago and all
Oh
over
my God.
Northwest Indiana, and for you to call my name is an honor. I never take it for granted that a woman would have me in her pregnancy
I don't
space, her
either.
birth space, or
Hmm.
her postpartum space when her body
Right.
is wide open.
Wide open.
Okay? And I love
It's so
you.
true. I love you too. Thank you so much for. It's
Yeah.
always been an honor to work with you.
Yeah.
Have have you work on me. It's always been a special thing. And just to go back to where you said where I kind of announced my pregnancy and said that I was gonna have you as my doula. One reason I did that is to let the word out, right? And the other reason was I let them know that I was taking donations for anybody who
Yeah.
wanted to, how people have baby showers.
Yeah.
I didn't
Yeah.
want that. I wanted to pay for postpartum services. So if you want to help me by giving to my postpartum fund, because a lot of people forget that that's one of the most important parts of birth, is what comes after the care that I get after. And I wanted to make sure that I had those funds in place so that I can have you there when I needed you there.
Wow.
So I think
And
that
since you
we
said,
need to take that in consideration. We need to make that important. Like just like you want to save up for those Air Jordans, just like you want to save up for that airline ticket for that trip, we really need to think about our birth and how important it is to us, how our postpartum period is important to us. You do not need all those toys for the baby. You do not need every rocker and swing. What you need is services and help. So if you can't get that readily from your family, it's okay to hire a postpartum doula and ask your family to say, hey, if you can't be there because you have to work, would you mind giving $20 towards my postpartum services? If everybody in the family give $20, you have a lot of hours to cover. So
exactly.
that's
And
really
that's,
helpful and important.
I'm so glad you brought that up. You know, one of the things that I advocate for the most is, and the reason why I started focusing more in the
Hmm.
postpartum was because one, it just became clear to me that much of our I'll say it this way, many of the traditions or things we haven't kept have to do, yes, with the way we birth, but also with the way we care for ourselves during the postpartum. And I believe
Absolutely.
that it sets a pattern for us. We've begun to um, to get accolades for how quickly we bounce back, whether it's our body, whether it's how quick you got, your body is still bleeding. You have this open wound inside. And I talk about it in my course. You literally have an open wound. It's not like, woman is bleeding. It's like, oh, okay, it's just like a period. No, it's not.
No,
It's not just a lining that's shedding. It's literally a wound.
Yeah.
And I always describe it as an elbow. It's like, it's like if a kid has, ow, ouchie, we call them ouchies. You have an ouchie on your elbow and you try to, keep it a certain way. But if it's on the elbow or on the knee, once you bend that elbow or bend that knee, all of a sudden it can, open again. It can do all these things because there's so much movement. And that postpartum period is about helping that heal, helping the circulation in a woman's body so her body can do what it wants to do. And I love that you brought that out. The fact that is literally one of our most vulnerable times. It's one of the reasons why when they count maternal mortality, they are not just counting, who died in childbirth. They are counting all the way up to the first birthday of the baby.
Yep.
Okay? So 1 year postpartum is counted as maternal. They count that. The governments count that as a part of the maternal mortality rate. And so we have to consider how we're caring for ourselves. And for that reason, what you said was amazing. And for that reason, it's important for us to learn how we can, if you're one of those that say, I just can't see myself putting out money for that, or I just can't see. She just said, let them know, girl, okay, I love that you bought me those clothes, but you know what? It's summertime. That baby ain't wearing them clothes. It's going to be too hot. Can you help me with my postpartum services?
Right.
I have somebody I really want to use. Can you help me with that? And I just wanted to put that out there. I'll be glad when all this opens up, because I had to cancel a whole workshop in Cincinnati, Ohio. I was about to go teach a 2-day workshop with different techniques. Girl, I know. Right? I'm always horrible at promoting my own self. I know, but it was, I had to cancel that and things, because these skills and things that we can learn about how to take care of ourselves. If you're not going to say, I'm going to purchase a service, then you need to do what my sister's been talking about the whole time, and you need to educate and equip yourself.
Absolutely.
And that is the minimal. That is the minimal. The fear that you have of, I don't want to go in that hospital, the fear that you're having, that's fine and good. But what are you doing? It's time to activate yourself. It's time to do that. If you are a doula that is feeling all kinds of ways about going into the hospital as well, I've heard that a lot. Doulas that are not, they're wanting to protect themselves and realizing that many people, while doulas might say they're essential people, that hospitals might not feel that way.
Right.
Don't forget about this virtual doula course that Christy does, because it'll help open up options, and perhaps it won't look the way that you intended. The way that you can serve women won't look the way the way that you intended. But right now, nothing looks the way we intended. Nothing looks how we thought it would be. So it's time for us all to adapt ourselves and go and learn. Go learn.
Can't go nowhere anyway. Might as well.
You might as well pop on there.
And so where's the greatest place, one of the greatest places you can start to go learn about postpartum and about women in pregnancy and about families? Please go to doulamom24@gmail.com to email Miss Christy Willis so that she can answer your questions, and also to be a part of her virtual trainings. Go to facebook.com/doulas for moolah. Ladies, I want to say, first of all, thank you for allowing me, Coach Green Jean, to be in this sacred space and conversation, because it was definitely enlightening. I wanted to say that for our parents, for our young people, please don't forget to register to CoachGreenJean.com on YouTube, because conversations like this and others have been archived on this channel for you for free. So while you're in this global pandemic situation and you're in your personal spaces, please use these opportunities to watch these videos and allow them to be enriching conversations for you and your loved ones. And I just wanted to say, this opportunity for you guys, planning right now into these families, while we're, contained, don't think that you're not storing up riches and opportunities for you in the future, because you guys are being built up and strengthened on the inner parts of yourselves, so that you guys can be ready for the opportunities that are being set before you. And I'm just thankful, and I'm just speaking that into both of your lives as individuals and professionals. People need you. We need each other. And so, yeah, let's take this opportunity to educate ourselves, to pray with each other, to show our responsibility for one another as a culture, as African Americans. Thank you guys so very much. I appreciate you. So in closing words, Dr. Doula, please let us help us exit on some beautiful closing words, as well as Christy. We hear and want to hear from you guys.
Well, Christy, I'll let you go first, beautiful. What would you like to leave with the people?
I would like to, I want to talk to the people who are specifically all of a sudden homeschooling now, just to remind you to do it your way. I know that the schools are having a lot of control over this, and I know that a lot of families don't have access to computers to get that work done. Use what you have in your homes to actively just teach your child what you know, love on them a little bit more, and just teach them about being a good human, okay? And loving the Lord, because right now that is the most important thing that they can learn right now. They don't need the stress of the news. They don't need the stress of the numbers of people dying. They don't need to know all that. They just need to know that they are safe. Okay. So for the birth workers, I want you to know that it's okay not to be wanted. Okay. If somebody says that they don't want you, clap your hands, because that is the first step of them self-advocating for themselves.
Yes.
So
oh my gosh.
It's not to say that, hey, you need me in your space. No, it's okay not to be wanted. Even if they don't want a doula at all. And if they come to you needing information, then you can offer your mentorship services and say, hey, you can dig into me and pull out as much as you want, because this is what you have invested in me. But if you want your sacred space to yourself, then that's perfectly fine. And I want to thank everybody for encouraging me too, because everybody needs encouragement. Amen.
Yes.
So I'm so thankful for my previous students that have been in the course. I'm so thankful for my previous clients, my friends, and my family, and that everybody has just been, kind of, I want to say, a chameleon. We've been changing, and this time has brought us so much closer together. We're doing family game nights and stuff on Zoom, and things like that. And it's just really, really good. So dig your heels into this thing and conform.
Thank you. And make sure you tell, before you go, Dr. Doula, make sure you tell your husband, thank you so very much for allowing you to be with us. Tell him we miss him, and we want an opportunity to be able to speak with him.
Yes, because the men in our lives need to hear other men in our lives know that they can do birth. They can do birth.
Yes.
We always said we were gonna talk with both of them. Remember we talked about that?
Yeah, we talked about that.
We're gonna make that happen where they can
my husband
share.
is still willing to do that. We just have to get on his schedule.
Exactly. Well,
That's right. He's making it happen,
yes.
catching the sticks.
Yes. Oh my gosh. I just want to say, you keep saying wonderful things, and I'm grateful for the last thing that you commented about, which was rejoice when they say they don't need your services. And that's so different than what is often taught in the birth world and birth culture, because it's been made into it's for some, it's their entire livelihood. And so in any good business and marketing, you have to say, hey, you need me. But we can't forget our ancestral context. We can't forget the truth. And let's not revision history.
Yes.
Let's not revision what is and what has been. Just
Yeah.
know that if that is your choice, Black woman, that you need to educate yourself. And
Right.
as Christy masterfully said, then go and get that mentoring that you need. If
Yes.
that's your thing, let Google be your friend. Find who you feel like you resonate with and say, you know what? I want to be able to do this myself. No, I really don't want a stranger that I just met 6 months ago in my birthing space.
Yes.
But can you help me get ready? And there
Yes.
are women that are more than happy to help mentor you
Absolutely.
in that regard. Christy,
Mm-hmm.
I love you. I love you. I love you. I cannot wait to be able to hug on you again,
Yes.
and see that how much everybody has just grown. And babe,
Yes.
thanks always. Thank you for Coach, for giving us a room for this, because you and I
Yes.
work together from the vein of Indigenous practices. So you in the construction, and me in the birth, and then we come together in the context of it being, this is about us being resourceful and
Yes.
restoring the dignity of labor. Now in birth, that sounds amazing.
It sounds both on both ends
Love
because
it.
my
Yes.
father was in construction and
Come
it's
on.
perfect. It's
Yes, we're
perfect.
restoring the dignity of labor on
Yes.
both sides, and the ability and encouraging people to
So
feed,
beautiful.
clothe, shelter, heal, and
Hmm.
protect themselves, and look for ways to do that again, to be self-reliant, to be
Yes.
resourceful. So I want to thank you for allowing us to share on your paper versus paper broadcast, because
Yes. Thank
this is
you.
not just a woman's thing. The fact that we rely so much on our husbands, you and her husband as well,
Yes.
shows that we need you all, and this is just as
We need
important
you.
as talking about
Hmm.
knowing how to build something else with your hands. So thank you for
Absolutely.
this time, babe. I really appreciate it.
I have nothing else to say other than you heard it here first on Coach Green Jean.
And I'm going to send you the link to be able to post the interview that we did with her. I went to her home to do it,
Oh, it
and
was so
those that
nice.
really, yeah, those who really want to like get a feel for what that process looks like about coming, being, knowing this is how we normally do it. We go to the hospital, we do this, and she talked her whole process out. She
Yes.
Wow.
talked it out, and I want to share that. I'm going to share it again in my social media platforms, but I also want to share the link so that those who want to um, connect through Coach Green Jean's platforms can do that as well.
Beautiful. Yeah, we can set it right there
Awesome.
in the description. Well, Christy,
Yes.
thank you so much. Thank your
Thank
family. We
you.
thank your husband, Jamil, and we appreciate you guys for being a part of
Yes.
Paper versus Paper. We encourage our
Thank
people, our
you. God bless
families.
you.
Yeah, thank you. Thank you so much. We encourage them to go and visit Coach Green Jean on YouTube so that they can subscribe and have access to these wonderful um, and beautiful and amazing information. So thank you guys so much. We appreciate
Thank
you. And we
you.
just wanted to say bye. Thank you guys so
See
much.
ya.
Bye.